My name is Dr. Abba Innocent Uchibo of the Department of Obstetrics and Gynecology, University of Abuja Teaching Hospital in Abuja. This year's WHO theme for malaria, I think, is most appropriate. The theme is Accelerate Fight Against Malaria for a More Equitable World, Ending Stigmatization and Discrimination. Malaria is associated with a lot of morbidities and mortality. The epidemiology of malaria, especially in sub-Saharan Africa, has been a very pitiful story. In 2022, data available by WHO showed that there were 249 million cases of malaria. And of this, it will surprise you that 608,000 people died of malaria. And of these, under 5 children had 76% death. So you can see what we are talking about, why more attention should be channeled towards people that need this. You know, all the countries in West Africa, for which Nigeria falls among them, has over 90% affectation rate of malaria. So it is time we take the fight against malaria very seriously, and it is time we also begin to address issues in terms of resource allocation for a very effective fight against malaria. Who are those that are likely to be affected by malaria? That is the question. Although sub-Saharan Africa is an endemic region for malaria, but again, let us look at the population that characterize sub-Saharan Africa. Now, you have under 5 children. They have very low immunity. You have aged population, you know, people that are elderly. They also have low immunity that are likely to be affected by malaria. You also have pregnant women, you know, whose immunity are already reduced because of pregnancy. And finally, you also have a lot of internally displaced people. Government should channel attention to these people. These are the people that really need malaria intervention. Every other population needs it, but this population do not have the resources to be able to. And most at times, you see that these are the population that are stigmatized and discriminated when it comes to resource allocation for malaria intervention. These are the people that should have access to long-treated insecticide nets. These are the people that should have access to drugs. These are the people that should have access to resources. Unfortunately, most of these resources ends up in the hands of the affluents. And this is what WHO sets out to achieve this year, for equitable distribution of resources and then to lead an effective fight against malaria. This campaign is powered by Health Without Borders. Better health, better living for you.